everyone. Welcome, welcome. Thank you so much for being here. As you can see, our setup's a little different today, but we are rolling with some tech developments all in one. Thank you so much to Dr. Foell for his flexibility. All right, so boso, everyone. That is a way to say hello or a formal type of greeting in Potawatomi. My name is Adriana Black, and I am the founding director of the Odehmenan Health Equity Center, or the Odeh Center for short. On behalf of my team, I want to welcome you all to our 6th Odehmenan Health Equity Speaker Series, Home is Where the Heart Is, exploring the vital connections between housing and health. The program is being recorded. As we enter into the colder months, we will be providing masks for those that need them here in person, as they remain an effective way to protect us all from the spread of infection. For a bit of background, Odehmenan translates to this heart of ours in Potawatomi. The Potawatomi people are one of the original peoples of the Chicagoland area and one of the Three Fires Confederacy nations who know this area as their ancestral home. I want to give full credit, appreciation, and gratitude to Donald Parrott, our friend, language expert, and elder who has been on the journey of creating this space since its inception and has provided all translations. Today, I am joined by Dr. Andrew Foell from the UIC Jane Addams College of Social Work. Over the course of this calendar year, we have been spotlighting the 7 health sciences schools and colleges in this series. Dr. Andrew Foell is an assistant professor at the Jane Addams College of Social Work at the University of Illinois, Chicago. Dr. Foell's research focuses on the intersections of housing, neighborhoods, and health, with an emphasis on housing and community development interventions for low-income families, including families living in U.S. public housing and other hard-to-house populations. His current research includes examining support services provisions and inter-organizational partnerships in the U.S. Department of Housing and Urban Development, Choice Neighborhoods Initiative, housing stability and neighborhood opportunity in adverse neighborhoods, conditions for youth living in public housing. Dr. Foell has also serves as the lead evaluator for the Illinois Permanent Supportive Housing Program, a statewide initiative in partnership with the Illinois Department of Human Services, Division of Substance Use Prevention and Recovery. Dr. Foell is a collaborator along with colleagues at UIC's College of Engineering and School of Public Health on a recent awarded research grant through HUD's Healthy Homes Technical Studies Grant Program, which will utilize community-engaged participatory research methods to address housing quality concerns and empower residents of Chicago's West and Southwest communities. Dr. Foell is a faculty fellow at UIC's Institute for Research on Race and Public Policy and serves as a principal and co-principal investigator on multiple externally funded projects focusing on housing and health. Dr. Foell is a first-generation college student and proud graduate of Ozarks Technical Community College. Dr. Foell received his Bachelor of Social Work from Missouri State University, Master of Social Work and Public Policy from the University of Minnesota, and Doctor of Philosophy and Social Work from Washington University in St. Louis. Dr. Foell teaches macro social work policy and practice at UIC. And so without further ado, I am done speaking and I will hand it over to Dr. Foell. Thank you so much.
Thank you so much. Excited to be here. I'm a little bit envious of the folks online, assuming that your weather is a bit more pleasant than we have in the building here, but thankful to be here. Excited to tell you a little bit more about myself and my work. Thank you so much for the wonderful, if not lengthy, introduction.
Perfect.
You make me sound, like I'm doing something worthwhile. So I appreciate it. So today I'm going to talk a little bit about my work at the intersections of housing and health. So the first half of the presentation will be sort of setting the stage, talking a little bit about what current research suggests in terms of the pathways from housing to health. And then I'll sort of contextualize that a little bit with some of my own research and what me and my colleagues are trying to do to address some of those issues. So before I get started, I do just want to say thank you and express my gratitude to the Odeh Center for inviting me to this talk and to the Jane Addams College of Social Work for their support and the support of Dean Hairston and all of my amazing colleagues over there. And so this is the agenda for today. First, I'll talk a little bit about kind of my journey to UIC, sort of how I got here. I'll talk a little bit about why housing matters in terms of social determinants of health, human rights, and global grand challenges frameworks. Then I'll talk a little bit about some of the pathways between housing and health. And then I'll focus on a couple of research projects to talk a little bit more about some of the work that I'm doing. I'll sort of wrap up with some emerging insights and recommendations based on that work, and then just sort of open it up for any questions for folks that are in the room or folks that are online. So first, I'll talk a little bit about my journey to UIC. So this is me on the left-hand side. Just want to start talking a little bit about sort of why I became interested in these connections between housing, health, neighborhood conditions, and sort of what has shaped my understanding and really my entire career. So the picture on the left is me about 17 years ago. I don't know if folks can see me that well online.
So 1 second, currently they're not seeing the slides. Give us 1 second. You can escape really quick and you're logged into the Zoom, right? So,
Great. So
there we go. So
should I share?
from the Zoom, yeah.
Sure. Is that better?
Switch
see my
the,
notes?
yeah, switch the. Usually,
So yeah, Steve Allen.
we can,
Screen 2.
yeah, try screen 2 actually, that's perfect, that should be. Yay!
Is that
Perfect.
better?
Yes.
All right, great. Well, here I am. So this is me about 17 years ago. I was an intern for an organization that provided comprehensive case management and support services to families that lived in public housing. So during a very hot Texas summer, I delivered furniture to families' homes. I helped set up appointments for health and social services. I did after-school programming and hung out with kids and their families. And it really kind of shaped my understanding of how housing and the context in which housing is situated can really have a tremendous impact on people's health and their well-being. And I think this experience in particular helped me sort of see how some of these big sort of key policies like US housing policy or our policy around investing in neighborhoods actually met people sort of on the ground. And so you could see very clearly how some of our policy decisions were actually affecting the day-to-day lives of families, and that really had a profound effect on me. And I met a lot of folks that had social work degrees, and so I would sort of open my eyes to this entire world of professional social workers that were working at sort of multiple levels of influence, from providing direct services to connecting folks to community-based organizations to doing policy advocacy work. And it really did change the entire trajectory of my life. The photo on the right-hand side there was taken a few years ago, where I worked the community group and some other local partners on a community engaged research project to sort of understand the connections between housing, neighborhoods, and health. And this particular project was community driven, community informed, and ultimately resulted in the selection of about 14 vacant and abandoned lots for redevelopment into a community park to support health that was directly sort of selected and chosen based on the community engaged research process with local residents that lived in the community and really wanted to take proactive action to address some pretty significant health challenges. And so I share all of that because these two images just are sort of emblematic of how I view my role, not only as a social work practitioner, but as a social work scholar, someone who deeply cares about engaging communities in addressing some of the challenges that affect their lives, and in particular around the connections between housing and neighborhood contexts. Okay, so now I'm going to talk just a little bit about why I believe housing matters in terms of a couple of different frameworks that sort of shape my work. And first, I want to say that it really is an honor to be sitting here today talking about issues of housing and neighborhoods and how they shape health, particularly in a city like Chicago, where the work of Jane Addams, colleagues at Whole House, and really countless other social reformers over 100 years ago were talking about why housing and neighborhood conditions are really important context for interventions that we want to address some of the causes of some of the health challenges that particularly low-income communities experience. And so Jane Addams was deeply concerned with housing in neighborhoods and how they shape health. And really one of the first actions that Jane Addams pursued was to rent a house on Halsted and use housing as a platform for building community, for providing social support and mutual aid, and using it as a basis to promote sort of broader social, economic, and political reforms. And clearly in Jane Addams' writing, for those of you that are looking at the slide now, you can see where Jane Addams and other folks were really concerned about things around housing quality, things around housing costs, and issues of overcrowding, and access to high quality housing units, and how those structural conditions and other aspects of housing connect to things like life expectancy and death rates. And this was over 100 years ago, and Jane Addams was doing this work. And I think particularly insightful is through that work. At the bottom of the slide, there's this quote around connecting housing to health and asking questions around why year after year, when we're observing these health disparities and health inequities, why we really aren't doing much to address it. And so I think my work really sort of falls on a long sort of legacy and tradition within social work and applied social research to really address some of the contexts that affect our health and well-being. This slide probably looks familiar to a lot of folks that are online and in the room, but housing is really a critical social determinant of health. And by social determinants, if anybody's unfamiliar with that term, these are just the conditions that in the environments where we sort of are born into, where we live, where we learn, where we work, play, and worship that affect a wide range of health outcomes, quality of life outcomes, risks for health-related problems. And research suggests that about 80% of our health outcomes are related to things that are outside of the actual healthcare system. So these are things again like housing, neighborhood conditions, air quality, transportation, and behaviors, which we know are shaped by the conditions in which we live and we grow up. And so this is a really important area and something that we can actually do something about. So how the housing and neighborhood conditions are not static, they're amenable to change. We have some promising evidence on interventions that are working quite well. And so housing, and again, with built environments, are really social determinant. Housing is also a basic human right and a basic sort of need for all families. And so the Office of the High Commissioner for Human Rights outlines a set of basic freedoms and basic accompaniments, particularly related to housing in terms of protection against forced evictions and the right to sort of be free of discrimination and oppression in terms of our housing circumstances, entitlements in terms of being able to have sort of secure tenure, be able to move freely, and really choose the housing where we live and to be able to choose to remain in that housing for as long as we're able to. And so housing really is a sort of basic right. And then housing is also intricately sort of interweaved across a variety of global grand challenges. And so social work has set out 13 grand challenges that as a profession, sort of collectively we have identified as needing significant focus for research, policy, and practice in order to create really a more just and equitable society. I know engineering has a set of global grand challenges, public health has a set of global grand challenges. And housing really is foundational for being able to make progress on any of these grand challenges. And so, like I said, the good news as I see it is that, again, housing and the context in which housing is located, we can actually do something about that. Given the sort of social, political, and economic will to do it, which I know, is quite a big challenge, but we can actually intervene to make things better. The bad news, and I'll set this up a little bit in the next few slides, is that currently in the U.S. we are facing an affordable housing crisis, and so I'm going to lay out what that means and sort of some of the pathways that connect housing to different health outcomes. So for the rest of the presentation, I'm going to use this 4 C's framework to kind of understand the 4 primary pathways that connect housing to health. And this was a framework developed by Foell and Hernandez, supported by the work of other folks that have identified some of the categories of ways that housing impacts health. And so I'll talk about cost. These are things around housing affordability. I'll talk about pathways between housing conditions and housing quality to health. Housing consistency, this is really around issues of housing stability. And then housing context, which is understanding the broader neighborhood and community context in which our housing is located. So housing costs represents one significant pathway between housing and health. And so one way to understand how housing costs are associated with health are to understand families who are considered cost burdened or spending more than 30% of their income on their housing. And we can see from a variety of different charts on this slide that folks that are experiencing housing cost burdens has consistently risen year over year, at least for the past 2 decades. These costs and housing cost burdens are disproportionately affecting communities of color, primarily African American and Hispanic or Latino communities. We've seen sort of an astronomical rise in families that are considered having the worst case housing needs. These are families that not only are cost burdened, but also living in inadequate housing and are actually receiving no federal assistance to support their housing. So this reached an all-time high just a few years ago. Just over 8 million families are considered incredibly sort of worst case housing needs and very cost burdened. And currently no state in the United States actually provides enough affordable housing to our lowest income renters. And so you can see that sort of reflected on the map here that shows the available units per 100 extremely low income families. And this is important because we have abundant research that shows that housing costs and housing cost burdens and things around unaffordability are major risk factors for negative health outcomes, including physical and mental health. We also know that housing costs, including things like costs for rent, utilities, and other operating expenses, really do drain the financial resources of households, which takes finances away that could be used towards health-related supports and services. And that over time, housing unaffordability can lead to sort of experiences of chronic stress that heighten the risk for other health-related concerns. Housing affordability also increases risk for experiencing some of the other housing-related challenges in terms of housing quality, context, and others that I'll talk about in a few slides. And even more sort of alarming is that housing assistance in the US is incredibly scarce. So only about 1 in 5 eligible households that could benefit from housing assistance actually receive it. So another pathway that housing affects health is through housing quality. So these are the actual conditions of the housing units where families are living. And so again, you can see on this slide, the number of households that are considered living in inadequate housing, again, has consistently risen for renters over time. And this disproportionately affects communities of color. On the right-hand side of this slide, you can see sort of an infographic that has been published by HUD around some of the common housing quality challenges that affect folks. And so these are things like poor heating and cooling systems, or even access to things like air conditioning and heating at all, things that result from deferred maintenance, exposure to sort of environmental toxins like lead, access to safe drinking water, whether or not there are sort of mold and moisture within the home, and other sort of conditions that are specific to the housing unit itself. And you can see that this is affecting, for some of these conditions are affecting, almost 15 or more million families, both renters and homeowners. And again, research shows that housing quality issues are associated with a variety of different health outcomes, lots of different physical health outcomes, including things like high blood pressure, respiratory conditions, other things like neurological problems, cognitive and behavioral issues. And there are clear causal evidence of these negative effects. So we actually have a pretty substantial amount of research that shows that housing quality conditions have causal relationships with mental and physical health. We know that exposure to lead, even at very low levels, is incredibly damaging, particularly for children. And housing quality concerns disproportionately impact vulnerable groups like children, older adults, individuals with disabilities, and low-income families. And the other thing that is particularly damaging about housing quality with health is that housing quality conditions actually exacerbate other socioeconomic and environmental challenges. And a very clear example is the effect of housing quality conditions on things like extreme heat experiences and extreme weather events that jeopardize health. And this is, one of the most sort of shocking and glaring examples of this was during the 1995 Chicago heat wave, where the experiences of extreme heat were incredibly challenging for folks, but it was in many ways poor quality housing in low income communities that sort of exacerbated those events and actually led to hundreds of deaths of low income families that could have been prevented. Another pathway between housing and health is housing consistency or housing stability. So again, a couple of charts and graphs on this slide. At least again, for the past 2 decades, we've seen notable rises in eviction filings, threats of eviction, and actual evictions of low-income families that jeopardize their housing stability. And we know that these, again, affect people of color and communities of color disproportionately. We also see a rise in instances of overcrowding that has increased in recent years for families that are doubling up or moving in with family. One of the contributing factors to that is housing affordability. But again, rises in factors that jeopardize people's ability to maintain stable, sort of high quality housing. And in terms of housing stability, again, connected to lots of adverse health consequences, including poor general and self-rated health, lower quality of life, mental health issues, and lower access to healthcare. And housing stability affects families also because it makes maintaining family stability really challenging. And so when folks are experiencing housing instability, this jeopardizes family stability, which we also know has damaging effects, particularly for children. And then another thing that affects housing stability I talked about one of those things, which is forced housing disruptions and displacement through eviction. But a lot of my work focuses on some of those housing disruptions that are a direct result of some of our housing policies. And this can have damaging effects on mental health due to exposure to sort of chronic stress through the housing mobility process, psychological trauma related to uprooting folks from their communities and sort of forcing them into the housing market that they may not be prepared for, and disrupting some important resources and support networks that families rely on to get by. And forced displacement, in addition to forcing folks into a housing market that they may not be prepared for, we know that these sort of forced displacements increase the risk of making multiple moves over time. So it can have the effect of creating a sort of vicious cycle of families sort of constantly being displaced from their housing situations. And then the final pathway that I'm going to talk about today is the context in which people's housing is located. And so this includes the broader neighborhood and community context where housing is situated. And we know that where your housing is determines the type of neighborhood you live in terms of access to resources and opportunities. It determines the schools that you have access to or that you attend. It determines local community institutions and the local sort of economy that you are exposed to. And it has sort of broader effects in terms of access to parks, recreation, the air quality, like literal air that you breathe is determined by where you live. And so some of the graphs on this slide just sort of show families' exposure to sort of extremely poor, high poverty neighborhoods over time. And we see pretty clear evidence that African Americans and communities of color more often live in very low income and distressed sort of neighborhoods. And they also have the least access to high opportunity or high quality neighborhoods. And the share of low income individuals living in extreme sort of concentrated poverty has remained pretty consistent, at least since the 1980s. And again, we have pretty solid and consistent evidence suggesting that neighborhoods impact health throughout the lifespan. And this occurs through complex interactions between things in the social, environmental, geographic, and sort of institutional contexts that are often sort of manifest and embedded within neighborhood environments. Significant associations between segregation and concentrated poverty with poor health outcomes. And this really results in exposure to health relevant sort of neighborhood risk factors, things like community violence, adverse community experiences, and other neighborhood-based factors that increase our exposure, result in chronic stress, and that stress can become sort of toxic and damaging over time. We also know that there's spatial clustering between numerous neighborhood conditions like poverty, segregation, and so on, and adverse health outcomes like life expectancy. So our life expectancy in many ways can be determined by the neighborhoods that we live in. And you and I can live in neighborhoods that are just a few miles apart, but have drastically different expectancies in terms of life. And we also know that there are significant positive associations between sort of positive neighborhood characteristics like neighborhood amenities, things like parks, recreational facilities, sidewalks, and libraries can affect our health. And so bringing everything together, housing, if it hasn't become clear in some of these slides, it's really important. And the National Academies actually just put out a report earlier this year showing that adverse housing and neighborhood conditions are very strong predictors of things like intergenerational poverty and socioeconomic immobility. And so they're really important and potential targets for intervention. So now I'm going to talk a little bit about my own work and how this sort of fits into these different pathways between housing and health, and then should have at least 15-20 minutes or so to have a broader discussion with folks in the room and folks online. And so the first set of projects that I'm going to talk about briefly is a project really to understand how and why housing matters for families and communities. It is a collaboration with folks across a variety of different universities and partially funded through the MacArthur Foundation. And we're really, again, thinking about the sort of 4Cs framework that I just talked about. We're really thinking about how does context in particular affect particularly low-income youth that are living in public housing. How does it affect their health? So we're looking at sort of the co-occurring relationships between things like community violence, neighborhood-based risk factors, parenting behaviors, and peer relationships that youth are exposed to, and trying to understand how they sort of affect youth health. And so in several different projects, we've looked at this. And so we've found sort of direct effects of community violence exposure, both witnessing community violence and being a direct victim of community violence, and several different mental health outcomes in terms of post-traumatic stress, depression, and anxiety. And this largely supports prior work in this area. We also see that there are direct effects of neighborhood-based risk factors that are not, community violence related. So these are things like youth's sort of community context, exposure to things like trash, whether or not the housing that they live in is, they would consider high quality. And there are direct effects of those conditions on some mental health outcomes, including youth anxiety. Protective effects of parenting practices that prevent youth exposure to community violence and neighborhood-based risk factors. And we also see that there are sort of distinct physiological stress responses among youth that live in low-income communities that are associated with mental health challenges. And so some next steps in this work, my colleagues and I are planning to look at housing and neighborhood protective factors like neighborhood resources and amenities, to see how those shape youth mental health, and really to inform some preventive interventions, particularly within housing and neighborhood contexts. Another project that I'm working on with colleagues at Washington University, Johns Hopkins, and University of Pennsylvania is really looking at the impact of mixed income housing and community development policy on families that live in public housing. So a few minutes ago, I talked about how a lot of my work is looking at how sort of federal housing policy can have a disruptive effect on families' housing stability through sort of forced relocation and things like that. And so I'm going to talk a little bit about this particular project, which again is a mixed income initiative. It targets distressed public housing for redevelopment. So there's money to support housing redevelopment, money for comprehensive case management and support services, along with housing relocation assistance for families, and money to invest to improve neighborhood quality. But a potential unintended consequence of these types of policies is that they do require families to move out of the housing that is targeted for redevelopment. In the context of choice, and I'll talk about this in a couple minutes, there are some policy mechanisms in place that allow families to return if they want to, and there is a one-for-one unit replacement policy. So any affordable unit that is demolished or redeveloped has to be replaced. Which is not the case with some past mixed income policies, for those of you who may be familiar with them. So like I said, Choice Neighborhoods is a current federal mixed income housing policy. It provides people-based assistance through comprehensive support services and case management. A majority of the funding goes towards housing demolition and redevelopment to improve housing quality. And then there's a smaller portion of funding that is dedicated to improving the neighborhood environment around the site in which the housing is located. And currently, the CNI is implemented in 50 sites across the US, started in 2010. There's variation in implementation across sites. So local partners have sort of the broad guidance from HUD, but lots of discretion over the types of services and programs that they provide. There's been limited sort of evaluation of the CNI. So we do have lots of research on prior mixed income initiatives, primarily through the Hope 6 program. But in terms of the CNI, there's just hasn't been a lot done. And there has been some mixed findings in the limited literature that does exist around potential health effects. And so some of the things that my colleagues and I are exploring are the extent to which families that are impacted by policies like CNI and whether this particular intervention helps facilitate moves to higher quality neighborhoods than they currently have access to during the redevelopment component of the project. We're looking at whether or not those moves are associated with quality of life improvements. And then we're doing some explorations around the impact of case management and comprehensive support services for families. So one of the sites that we're working in currently is the South City Choice Neighborhoods site in Memphis, Tennessee. Local partners, including the city of Memphis and the local housing authority and about 30 to 40 community-based organizations received a planning grant in 2010 to redevelop the Foot Homes public housing project, which was the last remaining traditional public housing site in Memphis. And so you can see sort of its changes over the years in some of the photos there. From sort of the 1930s and 40s when the housing site was first developed through the 2000s, documenting some of the conditions of the housing site that sort of made a priority for local partners to invest in, and then some of the redevelopment work that has occurred on site currently. And so partners received a planning grant in 2010. This was to develop the comprehensive redevelopment plan for the site. And then they received an implementation grant in 2015 of $30 million, which is then matched by local partners on a one-to-one basis. So in total, the entire project was around $200 million after leverage funds and matching. So like I said, the CNI, and again, this varies across implementation context, but in Memphis, all families were relocated at one time. So there was about 400 families that lived at Foot Homes when they were awarded the implementation grant. They did a mass sort of relocation effort to secure housing for all the families that had lived at Foot Homes to prepare for redevelopment. And now they're in the process of helping families return if they want. And the primary mechanism for mobility is the Housing Choice Voucher Program. So families that are affected by these programs typically are eligible to receive a housing voucher. They receive sort of priority access to vouchers to help them move off site. They're also able to move to other public housing sites if they want to. And then they do have a right to return back to the site after it's redeveloped if they choose to do that. And so the graphs on this slide show where the project is located, which you can see the arrow there, and where families moved after or during the redevelopment process. So this map shows neighborhood quality, which is an index that we use to look at changes when families moved. And all of the dots are sized by the number of families that moved during the redevelopment process. So most families moved outside of the project site. A pretty sizable portion of families moved within the same neighborhood, which we defined as zip codes. And so I'll talk a little bit more about that in a slide or two. And so we see that families moved to higher quality neighborhoods, sort of in the aggregate. So either through vouchers or through other mobility options, families did increase their access to higher quality neighborhoods. This is partially because the neighborhood in which the housing is located statistically is the lowest sort of quality neighborhood in the Memphis area. So really any move outside of that neighborhood would improve families' neighborhood quality. And then we looked at associations between the mobility decision and quality of life. So what we see on the chart here is that for all families, regardless of whether they moved within the same neighborhood or they changed their neighborhood, all families reported increasing their perceptions of home and neighborhood safety. But we also see that all families sort of had small but significant increases in stress over time. And so this just sort of summarizes some of the findings that I just talked about. We did find that housing vouchers helped families move to higher quality neighborhoods. And residents reported increased home and neighborhood safety, but also some increased stress over time, regardless of whether or not they moved to better neighborhoods. And in a follow-up study, what we're finding is that greater frequency of case management contact and higher enrollment in supportive services is associated with helping families move to higher quality neighborhoods and to actually return to the housing site if they choose to do so. And so some of the next steps in this particular project is to explore some of these similar dynamics across other housing sites. So we'll be doing this work in St. Louis and Baltimore, also two sites that are implementing the CNI, but under very different contexts. And we'll be sort of integrating some interviews with residents and support service staff to understand some of the barriers and facilitators to promoting housing security and support service access.
Just ask a quick info question. Yeah. Could you go back to the what is it? The delta on stress looks like it's tiny, like that. That's statistically significant.
It was, yeah. Again, it's a small increase. Lots of limitations with using. This is not something that I get into in this presentation, but these are single item measures. They're on a rating of 1 to 5. And in the paper, and I'm happy to share that with you, we go a little bit more into some of the methods that we use and some of the checks that we did to ensure that the findings were as robust as they could be given the data. But yeah, small but significant increase in stress. And part of this, and again, we were using administrative data, not perfect by any means. We weren't going out and collecting new data. But so that increase in stress could be partially due to the increased costs of housing. So it could be financial related. It could also be sort of navigating new community contexts. So we're not quite sure about that, but we hope that some of our interviews with staff and residents can kind of shine some light on that. Great question.
I have a question. You mentioned you're not collecting new data. You use that data is there.
So this data that we're using on this project is from Housing Authority and service providers. So they're collecting, it's administrative data. So they're collecting the data. We're partnering with them to look at some of these outcomes. Yeah. So we are in the sort of next steps. We are collecting new data in terms of the qualitative data. We're also bringing in other administrative data from school districts to understand how children are being exposed to different academic environments. But we're not, we didn't design a survey. We're not collecting data.
I asking that question because I'm from Little Village, it's more Latino community, and I'm very interested about housing, how affecting the community. But the data I collect is in the ground, talking with people, see the houses and everything. And I see a lot of trauma, like you mentioned about they infected with mouses, with cucarachas, all this kind of stuff. And you talking about crawling is so many people in the same house. It's not like you have your own family there, but you can do anything because everybody's there. It's they coming to school with a lot of trauma, no head space to do homework, nothing like that. And right now with new visitors, we have new arrives in our communities, is getting worse because the housing is high and people can move nowhere because no apartment, no places to go. And right now I'm very interested and I'm collecting information about trauma and how living with this, like rats and cucarachas and all that kind of situation in the house, how affecting the children, the family, and the whole community, how be affecting to violence too. And you mentioned about housing, it's about violence in the city, but we need to do more deep in the roots about violence because violence is about work. What kind of job you do? We do very healthy jobs, very precarious jobs. And this is the reason we stay there because we can afford it to have better housing. And this community, they can apply for anything. They not apply for anything for documentation situation. You just stay there and you not have resource for anything. And then this is that I really like to, and even people writing about, for me, about that trauma, to living in that kind of condition and how that shouldn't behave.
Right.
And that is just taken from the people, and then understand more about how they can healing component and try to figure it out to get together and do something differently. But I don't know, I know it's so hard because it's about money. It's about who has control about this. But yeah, it's a terrible situation of housing. And this is the reason I'm here to learn more about.
Yeah, well, I'm glad you're here. I'm excited to have some additional conversations. I think you're highlighting the sort of intricately interconnected thing. Even when we're talking about housing, and in this presentation, I've sort of outlined these sort of different pathways, but they're all connected. And certainly trauma is a really big piece of this housing sort of health connection. That in some of my work, we're getting a little bit, we're trying to understand that a little bit better. But in a project like this, hopefully some of the next sort of phases of this project where we're talking with residents and staff around some of the unique challenges that they're experiencing will sort of help illuminate some of that, because it's really sort of challenging and connected.
The situation is total disinvestment in Black and Latino community. They don't care about how we live. They don't care about trauma, nothing like that. We just living there because nobody wanna hear us.
Right.
And then this is a team united both communities. I think we have more voice to demanding more service and more resource for these communities. And this is that thing I do, be in the ground, touching people, asking people, and because I lose like them, they open to me, to give me information.
Yeah, and I think important questions around, to what extent are our policy decisions empowering folks, developing their capacity to be agents of change, or doing the opposite. So I appreciate that. I'm happy to engage in further conversation. A quick time check. Are we scheduled until 1?
We're scheduled until 1, yes.
Okay, got it. So I'll go through a couple of these other slides real quick,
Perfect.
and then we'll just sort of open it for
Sounds
questions.
good. We've got some questions in the chat already.
Okay,
so
great.
feel free to-
So I'm gonna skip over this project, not because it's unimportant, but just for the sake of time. I'm just gonna go to some of the finding slides, because we're in this project. My colleagues and I are looking at again the impact of receiving housing vouchers on housing stability and health. This is within a population that is sort of intertwined with the housing system and the child welfare system, and so. I can talk more about the family unification program if anybody's interested at the end, but I want to go sort of towards the end to talk about some of the findings. And so again, we looked at whether receiving sort of usual services, which is comprehensive case management support services alone, or in combination with a housing choice voucher, affected housing stability, and what potential trade-offs families might be making in terms of housing and neighborhood quality. And so this was a longitudinal randomized controlled trial, sort of natural field experiment. And so we can see here that the provision of a voucher in addition to usual services had a pretty dramatic effect on the probability of families reporting homelessness. So it did improve housing stability. And we see that improvement was sustained over the 2.5 years that we worked with families. But an interesting finding that we observed is that even though families were improving their housing security and their housing stability, the receipt of a voucher, and this study was conducted here in Chicago, receiving a voucher actually sort of pushed families into more disadvantaged and dangerous neighborhoods. And so one housing policy mechanism that we know improves housing stability, which is the housing voucher program, can have unintended consequences, particularly for very low income families with children who experience a different housing market that may place them at risk of entering neighborhoods that don't support their health. So again, happy to talk more about this project if anybody's interested. And we have my colleagues and I have a paper that we published on this as well. And then the last project I just want to touch on, it's a project that is just getting started. So I just want to make folks aware if anybody's interested. But it's a collaborative project with my colleagues at the College of Engineering, College of Public Health, and is funded through the U.S. Department of Housing and Urban Development through their sort of Healthy Homes program. And so in this particular project, we're looking at things like housing quality conditions, and particularly hidden mold exposure and effects on health within some of the Southwest and West Side communities here in Chicago. So again, this is a partnership with some local community-based organizations and alderpersons. And the project is going to be focusing on doing a health risk assessment or a housing risk assessment. We actually have funding to do the intervention, which is mold detection and remediation, and to develop a predictive tool to help communities predict what houses might be at risk of hidden mold growth. And then a substantial community engagement piece where we'll be working directly with residents to do sort of housing advocacy and awareness. And again, some of the questions that we're thinking about is how might early mold detection impact health outcomes for low-income residents, particularly with vulnerable groups. And then, what are some of the barriers and facilitators that community members are experiencing when it comes to things like mold detection and housing quality concerns, and how might some sort of community engaged interventions improve housing quality issues. And so just some emerging sort of findings and insights from some of mine and my colleagues' work, and supported by existing literature, is really a need to invest in high quality, affordable housing. I won't go into the details because I've kind of outlined them in the presentation already, but this is something that is severely needed. Expanding the Housing Choice Voucher Program and expanding that voucher program in combination with targeted support services and case management is really important. And then expanding resources to really address housing and neighborhood quality improvements by using community-based approaches and place-based investments. So with that, I will stop. I told a white lie to everybody whenever I said I would give us 15 minutes, but we've got 6, so I'm happy to open it up.
Well, first of all, thank you so much, Dr. Foell. That was really super informative. I'm going to start with some of the questions in the chat before we open it up to folks here in person, because it goes, I think, right along the lines of your recommendations, perhaps maybe expand even a little bit more. A question in the chat are, what kinds of federal policy would you like to see that would help attack the roots of these disparities? What local policies? And just an additional, on an individual level, do you have thoughts on what we can do to help keep our local leaders accountable? That's like I don't know what part you want to tackle there, but
Yeah.
Go ahead and solve it.
Yeah.
solve all our problems.
Yeah. No tall task. No, I mean, I do think that a stronger commitment to investing in affordable housing is something that is needed at the national level and the local level. Like I said in some of my slides, there are literally millions of people that qualify for affordable housing assistance that aren't getting it. And so I think a sustained investment, not only in the public housing system, which is one opportunity for affordable housing, but expanding the voucher program and other forms of rental assistance are really needed, because we have a lot of folks that need it, but not a lot of folks are actually getting it. And particularly with the Housing Choice Voucher Program, we have years-long wait lists. So your name goes on the wait list, you may not get a voucher ever or within the next 6 years. And so it's, like I said, the affordable housing system is really sort of in a crisis right now. A piece of that is that housing costs have risen, and I didn't put this in the slide, but there's been an increase in housing costs of about 18% since the 2000s. But the average incomes of renting households has only increased about 3%. So there's a huge gap between housing costs and what families are actually, financially able to pay for housing. So that, sort of speaks to labor market, employment sort of opportunities, living wage sort of jobs, and so on. And so I think those, it does take, a balance between efforts at the national sort of big P policy level and some of those things that we can do sort of on the ground with families. I think your work is, a good example of that is, working directly with families to understand, what are their experiences? How are these things, these big, gigantic sort of problems interconnected? And what are some of the best solutions given families' unique circumstances that can actually help that? But, a big piece of it is the funding. What was the answer?
Federal policy, local policy, and how can we hold our local leaders accountable?
Well, we're squarely in election season, so that's going to the polls and voting that way. I think community engaged work is really important. Building those strong partners with local organizations that are doing advocacy work sort of on the ground, and folks that can hold sort of local leaders accountable, I think is really important. I'll stay vague on that because quite honestly, I don't know that I have it. I'm certain that I don't have it figured out. But I think engaging, with organizations that are doing really important work and building some of those community partnerships is one step to that.
Thank you. Other questions here in the room, and if not, I'll go back to the chat. Questions here in the
I have
room?
a question.
Yeah.
In reference to the study where the housing units were being kind of revamped.
Yeah.
Is the goal explicitly or intentionally for folks to move back? I know you said that there were a number of folks who did move back. Like, is that the goal?
That is not the goal.
Okay.
So again, the choice neighborhoods work follows in a long policy history of poverty deconcentration and mixed income housing policy that started really in the mid 80s and sort of ramped up in the 90s through the Hope 6 program. The goal of mixed income development is to improve housing quality at the site to be redeveloped.
Okay.
And the idea is to provide people choices and opportunities in terms of their housing situation, whether they want to receive a voucher and move away long term, whether they want to move sort of into another public housing unit and then maybe return in the future. So the policy goals are to improve housing quality at the site that needs significant reinvestment and to expand choices and opportunities for residents. And so that's totally dependent on, there are some policy mechanisms within this particular program that allow folks to move away for the long term if they want to, or to move away just during the redevelopment period until they have the opportunity to move back. But the goal, there's not an explicit policy goal to move people back.
Okay.
The explicit goal is to give families more choices in the housing market, essentially.
I had a question regarding to that. When they development housing for this population, they asking them question like how you like to building the house and things like that, or just building the house and say, okay, we're gonna build the house, you need to move and coming back. This is that thing we building for you. They do it that way.
So that's part of the comprehensive planning process. So when grantees receive a planning grant, they do significant community engagement to inform that plan. And so community members are engaged throughout that planning process. And that is the time where community members can sort of inform the design. They can inform other aspects of the implementation. But there's a big asterisk next to that, because what goes into the plans and what actually happens during the development can sometimes not be congruent with what community members sort of envision for the site. And so there's yes, community members do have some voice in determining what the redevelopment looks like. They have choices in terms of voicing their preferences for returning and where they might want to move in the interim. They don't have a choice if, whether they want to move at all because they have to. And then, there are some of those design decisions and even eligibility criteria that there can sometimes be mismatches with.
Well, thank you. I know we have a few more questions, so maybe we can stay with Andrew for a couple more minutes, but I do want to just kind of officially close out the program, it being mindful of everyone's time. So miigwech, this is one way to express thank you in Potawatomi. It expresses a desire to reciprocate again in the future. Miigwech to Dr. Foell and to the Odeh Center team of Cassandra, Samina, and Makeda, and our OVCHA partners, Michael and Brian. And miigwech to all of you, both in person and online. Bama Pimain, or until another time in Potawatomi, as there is no word for farewell, and we expect to see each other again soon. So thank you all so much for being here. Maybe we can stick around and snag a couple more minutes of your time. I know there's more thoughts in the chat. I'm gonna keep the chat going. So if you all wanna stick around, I know there was a question we didn't get to, and there's another question here in person. But please fill out the form if you haven't already, because that informs the kind of work that we do in here, and it's totally anonymous and should take no longer than 2 minutes. So thank you so much. And so I'll get to, I think, our person online. I'll get to our question online that was asked earlier. Is there another term that can be used to describe the neighborhoods instead of low, moderate, or high quality? And I think that the suggestion here is perhaps low, moderate, or high resourced. And I'll kind of add on to this question. One of the thoughts that I frequently have, especially in the world of public health, is using words like risk factor. And if there's better words that we can be utilizing, especially when discussing community interventions and the health of communities, that we should maybe instill into our day-to-day.
Yeah, I think that's an excellent point. And there are, folks are using a variety of terms to sort of describe similar contexts. So, honestly, these are communities that have experienced legacies of disinvestment as a direct result of our housing policy and neighborhood policy decisions. And so, yeah, there's neighborhood quality, there's neighborhood opportunity, there's sort of, you can categorize, folks have categorized neighborhoods by income levels, so low income, high income. I think our use of terms is sort of constantly sort of evolving, but I do recognize, a need to have better terminology, is to not insinuate that neighborhoods don't have really important resources and assets to build upon. And so, yeah, I don't know that at this current time there's like a term that that is sort of broadly used to describe it, but some of the folks in the chat, I recognize that there are experts in the room, and so yeah.
Thank you. I know we had a question here in person as well, so please feel free.
Thank you so much for your talk. I kind of in that vein a little bit. How do you kind of maintain the culture and the community and the networks? Because even though you might have a 1-for-1 for affordable housing, not everybody who lives in an affordable housing community necessarily is a part of has the voucher program. So how do you maintain that? And to this woman's question as well, I guess, how do you maintain the things that are important to communities without necessarily trying to make it essentially whitewash, because thinking about a desire for multi-generational households. So a lot of times you have one house with 3 bedrooms. Is that gonna fit grandma and auntie? And I also have a large family. So, how do we kind of incorporate the cultural pieces that are really important, like having a corner store, having these things, instead of kind of saying, well, the neighborhood was all bad, right? And that kind of goes to that piece. So how do we kind of maintain the really important social fabrics and communities? Because now you're also away from churches if you're moving from a different location, or you're moving a location away from a bus line, right? Like, so how do you kind of integrate these pieces, and how do you account for that kind of in your research as well? And I also wanted the one thing I wanted to also stick a pin in is that the mixed use housing, is there also a possibility to look at the other people who live in the mixed use housing? Because they also receive a benefit from living in a multi-generational community, right? So how do we capture that benefit as opposed to just saying,
Yeah.
to your neighborhood, like they also benefit. So have more of a mutualistic kind of language. So I'm sorry.
Yeah, no, those are excellent. I'll try to do my best to respond to that. So in our work, we to date have not been looking at the dynamics that unfold once people start moving back to the development. And so a lot of the work that I presented here, we're looking at all sort of affordable public housing families that lived at the site. Where do they move? It's sort of when the project is being redeveloped. How is that impacting their health? How is that impacting their children's sort of educational experiences and things like that? We know that this forced disruption severs really important community ties. It severs social relationships. People make decisions based on their support system, and these policies that forcibly displace and relocate people have, I don't even want to call it an unintended effect, because even just sitting here thinking about it for 30 seconds, we could, expect that this was going to happen. And so a little bit of some of your question is like, when folks are moving back, we're going to have affordable housing renters, we're going to have market rate renters coming back to the site. How do we maintain the sort of cultural sort of roots of the original community without sort of whitewashing or gentrifying communities in the process? My personal work hasn't looked a lot at that, but there is a lot of research coming out of the Choice Neighborhood or the Hope 6 program that shows even when, the idea is like we get low income folks and people that have higher incomes, to mix, there's some sort of benefit, that comes from that through employment opportunities, through behavioral expectations, things like that. But we know from Hope 6 research that keeping people in close proximity to each other, it doesn't do much in terms of promoting any sort of health benefits for low-income families, employment opportunities. There's lots of social exclusion that happen at the sites between low-income renters and mixed-income families. And so I think part of that is, it goes a little bit into like, what are the sort of broad goals of these initiatives? I think one point of intervention is through, some of the support services and case management that families are receiving in terms of the choices that they have and the information that they have access to. But I would say like this particular intervention, the broad goals are really to provide choices to families in terms of their housing, limited choices, and to improve housing quality. And my sort of experience is that there has been a lot less attention on the historic sort of cultural preservation of the site, the dynamics that are unfolding across race and class of the new sites. So I think that's really an area that needs much more attention. I know I didn't even begin to fully respond to your question, but that would be my first two thoughts.
Well, thank you all so much for being here. I don't want to take more of Dr. Foell's time or anyone else's time, but thank you again for engaging with us, both here in the center and also online. Again, I'm going to post the feedback form into the chat, and I'll make sure I show you all the QR codes so you have it. But thank you again to Dr. Foell for being here with us, and thank you all for coming. Appreciate it.
Thanks, everyone.